price has spiked to $600. What's going on?
It seems expensive.
Yes, it does.
I would. There's a lot of reaction to this. This was just done over the internet and in a lot of papers, a lot of the news media, and we're focusing on EpiPen. We're focusing on these terms of price gouging.
Right.
But this is, to me, a symptom or indicative of actually a much bigger problem. And the much bigger problem we have is we have a system in this country that looks out for and protects patents and trade name drugs, and ignores generic drugs. And we actually have a bigger problem than just the EpiPen, which is a big problem because $600. You talk about school districts that can't afford. St. Louis public schools have lead in their water.
Right.
They got to get that fixed, and each one of them by law has to have some EpiPens around in case kids run into trouble. This is a big deal. But there's a lot of other drugs out there that are only made by one company. They're generic, and that company has no competition. And so the great capitalistic American way says you can charge whatever you want for them.
Right. Well, this goes into, and I know this is a medical segment, but it's sort of, this is where the world collides, is these people complain about the government not getting into our health care. And I don't want the doctor in my room. Well, you can't have it both ways. Do you want the government to help regulate these drugs, or do you want the free society? Because if you get that, you're going to get an EpiPen for $700.
Exactly. So there's got to be some balances, and there's going to be government in healthcare. I think this whole concept of we don't want government healthcare and all that, that really does need to be put to bed. There is no such thing anymore anywhere where government isn't involved in healthcare. But in terms of where we sit with this is an issue in terms of how to try to protect the public. I mean, the other thing is we can protect our trade name drugs, but the other thing that came out was, some of our trade name drugs sell for a fraction of the price in Canada and in England. A big cholesterol-lowering medication that's very expensive here in this country sells for a fraction of the price in England, and it's the same medicine. The exact same medicine.
And that's because the governments are involved in regulating the price.
Right, and so these companies can charge what they want here, and they can't necessarily charge what they want, or the market doesn't bear them over in Europe or in other countries, and so the price structure is very flawed.
But not every drug has a generic drug, though.
That's correct. So the U.S. grants a certain number of years of a patent protection once a drug comes out, and then after that leaves, and so the last major cholesterol-lowering drug of the statin brands was Crestor, and that was a trade name drug, and that just lost its patent, and so now that's become generic. So one of the points that I'm trying to make is just because a drug is generic doesn't mean the price are going to fall precipitously, because if only one company is making that generic medicine, it's just the same, if not worse.
Let me play the other side of this, though. The drug companies, if they were sitting here saying, to develop, create, and to test the EpiPen costs billions of dollars.
Yep.
To make the next pen costs a nickel. The first one costs $20 billion. The second one costs $1. So we need to recoup that. And how do you go about with these life-saving drugs if there's not a way to recoup the costs of development?
Well, I think a few different points on that. Number one, the development of the EpiPen happened a long time ago. The subtle iterations and changes to the EpiPen on a year-to-year basis over the past several years have been present but subtle. And a 400% price increase over the past 4 or 5 years, I don't think is indicative of a 400% change in research and development which has gone into the EpiPen. So I don't buy that argument of why that price has gone up. Number two, and this gets a little bit unfair, but it gets into, when you charge X number of dollars for a product which potentially is life-saving in our society, then you open up the doors of how does your company work? Because you have a public company, and those public things are disclosed, and this breeds outrage. And so the numbers that have come across with respect to the CEO's pay of this company are astronomical. Her pay has actually gone up at a far greater percentage than the price of the EpiPen. And I don't begrudge anybody of what they get paid and what their job is, but I mean, this is scrutiny that they're bringing on themselves.
Well, the other thing, too, is so an EpiPen costs $600. Let's say you have insurance that covers your EpiPen. Well, guess what? You're not paying $600 a month for your insurance. So that cost is then spread out through all of us. I don't have an EpiPen issue. I'm, quote-unquote, paying for your EpiPen. My insurance is going up. I'm complaining that my insurance is going up. And then you get into the argument where people are like, I'll only buy the insurance I need. I have cancer, so I'll buy the cancer insurance. I don't have sickle cell anemia. I don't want to buy that insurance. And if you think that way, the whole system collapses.
Well, the whole system is close to collapsing along the same argument you just brought up, because the cost that everybody has to bear is markedly inflated across multiple different realms, and we've created a society and a context of being able to look at things like healthcare in an overly simplified concept, and we've tried to isolate who's bad and who really is the problem in this, and tried to make it as simple as possible. And there's not just one problem. And so I can protect the doctors, but we've been under attack. And so our prices and what we do, we overtest and we overprescribe medications, and we cost too much. And we've clearly been singled out as a major cost in this. But insurance companies, their rate hikes for your insurance go up somewhere between 17 and 20% per year on average. I don't think your income goes up that high. I'd hope it would, but
right.
My guess is it's probably not.
Right.
And that's those are insurance companies, and they're protected under nonprofit status, most of them. The insurance lobbyists are pushing government to stay out of their business. Hospitals doing the same thing. Big pharma doing the same thing, and so there's a whole lot of different special interests there, and I think this gets back into the political season where people are upset with the current government,
right,
and they don't know how to fix it.
Right. Well, and there aren't a whole lot of answers out there. There's a whole lot of people complaining, but there's not a whole lot of answers.
I think the answer is really we got to go back. Every time, to me, something gets really complicated. Do this and taking care of people too. When something gets really, really complicated, you got to go back down to the bare basics of things. And to me, on this issue, these issues, cost of healthcare, cost of EpiPen, that kind of thing, we need to actually start having a real conversation, not getting emotional, not trying to blame people, but having a real conversation and figure out how can we make it better. And we need to actually start working on it. And we can't say he's a bad guy because he's not in my party, or she's somebody that I don't trust because of something, and we need to actually just start having a conversation, or this is not going to get better.
Well said, Dr. Michael Lim. That's why he's a cardiologist at SLU Care and SSM Health, SLU University Hospital. Also with us every Wednesday. Thanks, Doc, for coming in.
Have a great one.
You got it. Thank you. 8:26, Big 550.